Time for the Bottom Line, and we turn to our chief Washington correspondent, host of This Week, George Stephanopoulos. So, George, some 5 bills in varying stages of negotiation here. What do you know now, if any of this is passed, will change in American lives of the people watching this morning?
I think the chances that something will pass have dramatically increased with that vote in the Senate Finance Committee this week. And as you point out, there are big differences between the 5 bills that have been passed, but they have these 3 things in common. So this is likely to get through in the end. Number one, everyone will be required to buy health insurance. That's the number one issue that's a consensus right now among the various bills. 2, lower and middle income people will either get more Medicaid or subsidies to help pay for that insurance, and that will be paid for with big savings in the Medicare program, hundreds of billions of dollars. And number 3, there will be big insurance reforms through these insurance exchanges. You can't lose your health insurance if you lose your job. You won't be denied health insurance if you have a pre-existing condition or sickness.
And the president has said he wants all this done by the end of the year. Will it happen, and what are the big issues they're still going to wrangle?
As I said, I think the chances have dramatically increased, but there are still some big issues to work through. Number one, that public option. You saw right there, Senator Olympia Snowe has drawn her bottom line. She will only accept this so-called trigger on the public option that goes into effect if the private insurance industry hasn't done its job. House Democrats and progressives are not going to like that at all. Number 2, a big difference over whether employers should be required to buy health insurance for their employees. And then I think probably the biggest question, Diana, is how to pay for all this. There are huge differences between the way the Senate Finance Committee bill pays for it with a big tax on the insurance industry, and the House Democrats pay for it, an increase in taxes on the wealthy, and there is no common ground there right now.
Okay, George, our thanks to you.